From Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi everybody, welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we continue our conversations surrounding nutrition and diet. In this episode, we're going to discuss prediabetes and the ways in which diet can help reverse course to avoid diabetes. Our guest today is Laura McElroy, a clinical dietitian here at Sarasota Memorial. Thank you so much for joining us today.
Thank you.
What exactly is prediabetes?
Prediabetes can also be called impaired glucose intolerance. And what that really means is our blood sugars are elevated, however, they're not in the range to qualify you as being diagnosed with prediabetes. So our body makes insulin, which is a hormone, to help us regulate our blood sugars. And in prediabetes and diabetes, this doesn't work efficiently, so our blood sugars are elevated. And that can cause damage to our heart, our kidneys, our eyes. 25% of the people diagnosed with prediabetes will develop type 2 diabetes within 5 years if it's left untreated.
How is it diagnosed if it's not yet diabetes?
Good question. Diabetes is diagnosed with a routine blood test. When you go to your physician, they'll do a random blood test, a routine blood test, and they'll measure your blood glucose levels. If that falls into the range of 100 to 125 milligrams per deciliter, that is equal to a diagnosis of prediabetes. We also really look at the A1C, or glycinated hemoglobin, to find out your average, what your sugars have averaged for the past 90 days. And if that comes out into the range of 5.7 to 6.4, that also qualifies you as a diagnosis with prediabetes.
What are some of the risk factors?
So there are a few risk factors we can look out for. If you're greater than 45 years of age, children can have prediabetes as well. But for adults, usually greater than 45 years of age, being overweight is a risk factor. If you're a female, having polycystic ovarian disease can be a risk factor. Sleep apnea, high cholesterol, or being part of a certain ethnic group, being Black, Hispanic, Native American, or Pacific Islander are at higher risk for developing prediabetes.
You mentioned weight in there. What's considered a healthy weight?
That is a tricky question, but I'll tell you how we measure weight. What we look at is your body mass index. It's a range of numbers we've come up with to identify risk for certain diseases. So your BMI is calculated using your weight in kilograms divided by your square height in meters. So we've come up with a range of numbers. So if you fall between the category of 18.5 to 24.9, that's normal weight. If your range is 25 to 29.5, that's pushing overweight. If your BMI is greater than 30, that's considered overweight.
Is prediabetes reversible?
Yes. And I really focus on 3 modifiable factors. You want to modify your diet, you want to maintain a healthy weight, and you want to create an active lifestyle.
So let's talk about modifying diet specifically. How do you help patients in this category to avoid developing diabetes and lose any weight they may need to?
Okay. One of the best ways, or a first great stop to look at, is called the USDA My Plate method. And so what you want to do is you want to look at your plate and divide it in half. So 1/4 of your plate is going to be carbohydrates, complex carbohydrates. Again, fruits, whole grains are going to be in that category. Then the second 1/4 of your plate is going to be protein, lean meats, fish, chicken, soy products, meat alternatives. The other entire half of your plate is going to be vegetables. And that's going to be anything like lettuce, tomato, broccoli, cauliflower, any kind of vegetables you want. Roasted vegetables, raw, are acceptable.
Sugar seems to be in everything we eat now, and especially for this population, sugars need to be controlled. So how can you avoid some of those hidden sugars?
Hidden sugars tend to be everywhere. Allison, you're correct. So they tend to be in processed foods, sauces, condiments, salad dressings. So we want to aim for 25 grams of sugar or less per day, which is equivalent to 6 teaspoons of sugar. So I like using that number of 25 grams because if you're looking at a food label, they are going to have total sugar. And then you can kind of base your decision off of that number. So if a food seems to be higher in sugar, based on what you're eating for the rest of the day, you could choose to include it or maybe look for a substitution that would be less sugar.
What about fats? How can you help people determine what's considered a good fat versus a bad fat?
I think the general rule of thumb would be the desirable fats or the good fats are going to be the unsaturated, the monounsaturated fats. We're looking at canola oil, olive oil, avocado, nuts and seeds in that category. The undesirable fats are going to be like butter, fat in meats, high-fat meats, processed meats. And if you want more information on fats specifically, you can join into our cardiac discussion where we'll go into that in more detail.
It's not just food that is a problem. It's definitely beverages too. So can we talk about that?
We can definitely talk about beverages. Things like specialty coffees, energy drinks, sodas tend to be laden with high fat, high sugar, high calories in them. So some of the tips that I'll tell my clients to do is to, if we're talking about specialty coffees, maybe going for a smaller size, maybe looking at omitting something like the whipped cream or looking for a syrup that's maybe has less sugar in it. When it comes to soda, maybe switching to seltzer water, waters that have the little flavoring packets in it, that can be a good alternative too. But I think we need to definitely be aware that what we drink during the day does count as part of our daily intake.
Knowing that many people in this pre-diabetic and diabetic population are working towards losing weight or have been recommended to lose weight for a number of reasons, can you talk about fad diets and diets meant specifically to drop weight? What concerns you about those?
I think fad diets have been around forever. In 2023, the weight loss industry was topping out at $90 billion. So this is not going to go away. Fad diets are not going to go away. In our desire to lose weight, to become healthy, sometimes it's easy to fall into the trap of, I'm going to follow this fad diet. And what they tend to do is they tend to be isolating certain nutritional groups. So maybe you have to take out all the carbs, or maybe you have to eat only this kind of meat. So they have a set of rules. Within these rules, you can develop nutritional deficiencies or electrolyte imbalances. And sometimes they have unwanted side effects. And with fad diets, you're really trying to follow the rules of the fad diet until you do lose or don't lose the amount of weight you wanted. You get bored, it gets repetitive, or it gets expensive. So then people quit that diet, go back to how they were eating because they missed it or their family's still doing it, and then they tend to just keep waiting for the next fad diet, which really leads someone to the yo-yo dieting, and that tends to be unhealthy. As dietitians, we really want to promote weight loss over time, which can be sustainable and healthy and more likely for you to keep the weight off. And in doing that, you develop healthy habits, which can last you for a lifetime and prevent diseases.
And those habits can be passed on to other family members as well, those healthy habits. If they see you eating well, they're going to want to emulate that as well.
Agreed.
So what can people do to avoid diabetes? Maybe they've been diagnosed as pre-diabetic, maybe they haven't yet, but maybe they know that they have one of those risk factors we've discussed. What can people do?
I think definitely knowing what your risk factors are. And then I think really embracing the modifiable lifestyle factors, focusing on your diet, modifying it the best way you can, trying to obtain a healthy weight, and increasing activity. Those are really the key points to helping you from developing prediabetes.
If someone is actually diagnosed with diabetes, do the dietary recommendations change at all from those who are pre-diabetic?
They don't change greatly. Eating a healthy diet is going to help you prevent prediabetes, and if you're a type 2 diabetic, they're going to help you control your sugars. We might focus more with someone with type 2 on carbs at meals and being sure we're getting enough protein at meals, but the guidelines are pretty much the same.
Is there anything else you want to add specifically to this population?
I think the word prediabetes can be scary. So if you think you might have diabetes, if you've been diagnosed with diabetes, don't be overwhelmed. There are tons of resources out there to help you make changes and promote wellness.
Where can people turn if they want more information?
There are a lot of good resources. You can go online and just come up with a BMI calculator. The CDC also has a BMI calculator. You can go to the USDA and get the MyPlate plan from there. We have a great diabetes treatment center here that can help you with any of your other individual needs.
Laura, thank you so much for joining us and answering all these questions.
Thank you.
As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.